Welcome back to Your View.
Thanks for staying with us. So the Lagos State government recently unveiled its compulsory health insurance scheme that would avail Lagos residents access to quality health care. To enlighten us more on this is our guest from Lagos State Health Management Agency, Lashma. This is the Lasma, Lasa, Laseba, Lasika. No, it's not Lashma. I don't know why you got to do it. Okay, he's the head of business development, marketing, and strategy, Mr. Rotimi Olatuji. Welcome to the show.
Welcome, good morning.
Before we get into the business of today, what's your thoughts on this female underwear issue? I mean, we discussed it on the hot topic. What are your thoughts on it?
Still thinking though, but I think females should stop wearing pants.
Why? Because people are stealing it.
That will be foolproof.
Ah, okay, all right. So you can join the conversation on 07080668014. You can also tweet to us at TVC Connect. Please hashtag YourViewTVC so we can read your tweet. So tell us what this insurance scheme is about, because obviously we've always bashed the government because we hear of NHIS, we hear of the fact that there's embezzlement of money is being allocated, yet for whatever reason the HMOs are not getting it. You know, you get all sort of stories from different angles. But Lagos State is somewhat taking an initiative to help those living in Lagos. Tell us about this initiative and how do we access it?
Okay, thank you very much. Good morning all. The Lagos State Health Scheme was launched on the 18th of December 2018. And let me just go through some level of historical antecedents. The idea to have a health insurance scheme in Lagos State was actually mooted by Asiwaju Bola Ahmed Tinubu while he was governor. And since then, the current Commissioner for Health, in partnership with a lot of donors and partners and technical group, have been working on putting on ground an agency that will midwife and supervise the scheme for residents of Lagos State. And so finally we launched the scheme on the 18th, and as I speak now, enrollment and registration is going on. Now, what do we mean when we say a health insurance scheme? It's a form of social security for the residents of Lagos. It is going to put a lot of people out of poverty line. It is the best global practice. And what we seek to do is to guarantee access to healthcare, accessibility, affordability to qualitative healthcare anytime, anywhere you need it within Lagos State. Now, you will be qualified if you can present your LASRA ID card or any form of identity card that can show that you reside in Lagos. And so therefore, LASHMA as an agency of government has empaneled and registered private and government hospitals that are going to provide services under the scheme. And also we're partnering with HMOs, that are the health insurance agents, that are going to work at the demand side of the business. It's a business of health this time around. Register people, bring in people, adjudicate, and of course ensure there's quality assurance at the supply end, which is from the provider.
Yeah, go ahead.
I'm hearing that this is not purely a government-run business. It's a PPP. The money goes to Lagos State, or does it go to the HMO, or how do we access? What's the cash flow?
Every premium paid by an intending enrollee goes to the account of LASHMA, comes to government.
Okay.
Government has a responsibility to now pay the provider for the service that are being rendered. Upfront, that's what we call capitation, ahead of time, because you would never know when you pay, when you will need to access care.
Right.
And then fee for service as you refer for secondary care services.
Right. So what's the burden? What's the burden on the potential enrollees? What are the numbers? Are people going to be paying high premium? You said premium. Everybody's worried. How much would that cost us?
Well, at inception, insurance is not 1 + 1 is 2. Lagos State government consulted actuaries to be able to put the figures together and see how much.
Consulted who?
Actuarists. Actuarists.
What is that?
Actuaries are professionals that helps you to simulate and tell you how much you should pay for certain insurance benefits.
Okay.
Or for catalogs of insurance benefits.
Right.
So that it's sustainable at the end of the day, so that what you pay is scientific and it can guarantee continuity, you know.
Okay.
So therefore, the actuaries came up with a premium It's in the range of about 80-something thousand or thereabout. But Lagos State government has been able to do a lot by ensuring that citizens pay 40,000 naira per family as I speak. So it's highly subsidized.
That's annually?
Annually for a family of 6, father, mother, and a maximum of 4 children.
Yeah, 4 children.
And therefore, an individual will be paying 8,500 naira. And so government has made the scheme to be pro-poor, for it to be very affordable for the residents. And so if you have additional dependents, you could pay 6,000. That's when they are below the age of 18. But if they are above the age of 18, they can pay 8,500 as a premium for a single person.
That's for your parents.
So
yeah, parents. Yeah.
a family is 8,500.
A family is 40,000.
Annually.
Per annum.
Yes.
And for that 40,000, you go to the hospital. You have to break it down for people like me. You go to the hospital for free.
You go to the hospital without paying a dime at the hospital end. Yeah. For the
There's always a catch.
So if you have one serious illness now, you still won't pay.
There's a defined benefit package.
Exactly.
Every insurance policy has defined benefit. It doesn't
so
cover.
So
my
the
question
emergencies.
is,
Okay.
you know, I was reading this, and for me, I think it's a very good initiative that a state should be able to do that for its residents and its citizens. And that Lagos State, as usual, is heading, you know, doing something like this. I don't think there's any other state in Nigeria that's doing that. And I've always found the NHIS a bit too far off for people, you know, because we have stories of, you know, the execution of it, corruption, who do you go and meet? But when the person is, you know, from the state, it's sort of, you know, easier to access and get there. But my point is, we've always had issues with executions of fantastic ideas are not, you know, hard to come by in Nigeria. But the execution of it, and then the very important, the very
Details.
no, like corruption is something that always affects everything we decide to do in Nigeria. So in the execution of it, my question is now, why? How do we ensure that this is not just a good idea that finally just, you know, doesn't make it, doesn't cut it? We have issues with people talking about the HMOs. You go to the hospital, they say we don't recognize this HMO. You know, things like that.
Oh, thank you very much. Foremost, I'd like to say that the fact that a woman had a sad incidence of losing a child does not mean she won't get pregnant again. We have learned from the ropes. We've looked at the downside of the NHIS. We've looked at models all over the world. We've looked at models in Africa. And I can guarantee you we've put in place measures that will ensure that this scheme works. On the side of the hospitals are key in the value chain, those that will provide the services. We have empaneled this hospital and we have quite a very high standard. There's a unit called EFAMA that is responsible for accrediting these hospitals. There's a quality assurance mechanism that we're using currently. And so therefore, even the hospital that you find by way of physical facade that you think probably, oh, this is a good hospital, you discover that we may not even be registered hospital because they are falling below standard. So there are standards.
Okay. I'd like to go back to what YK was trying to say earlier, because the issue of benefits, what exactly is covered? You know, there are different schemes, there are different categories, and we've had issues of cancer, diabetes, people are having diseases, and you have the regular malaria, fever, those ones are covered. But the real core that people need,
the one that will kill you,
that they'll tell you, those things are usually not covered by insurance companies. You have to find out. So tell us exactly what are the benefits based on the package, so that people know what they are in for. Do I still have a private one on the side, or is it just the basic stuff you're going to be covering for me as a provider?
Thank you. You do well as an advocate of the people, you know, from your questions. This scheme is social health insurance scheme.
Okay.
It's not going to give conditions that you are not covered because you are pregnant. In fact, if you were pregnant today and you can buy the plan today, you are covered. So it is not like the private scheme that you find the HMO selling. Okay. It's a social health insurance scheme. Okay. And it has defined benefit, like I said. So let me just give you a summary of the benefits that are covered. You know, before you put on a list of benefits for an insurance policy, you will have done some back-end research to see what usually do people go to hospital in Lagos State for. You know? what are the trends. You have what you call encounter data from the hospital to show you that if you must design a plan, these are the things you should be covering because people seem to be consuming more of this kind of service. So we have our outpatient consultation, that is common ailments and conditions. Okay. You have maternal care, you have newborn care, and then you have cesarean session, if it is necessary. It's carried out for even 8,500 naira. And then you have TB testing and HIV testing. You're also covered for chronic ailments, which are basic chronic ailments like diabetes, okay, asthma, hypertension, gotcha, and in that category. Right. And then you have herniorrhaphy, minor surgery herniorrhaphy. You have appendectomy, and then
no cancer.
No, I mean, the NHS is also discussing that, but it also says that the primary health center is supposed to be the first point of call for all enrollees.
Yeah.
Could you just talk about that?
Well, if you are on a plan, you choose a primary provider. Mm-hmm. So that's your first point of call. Actually, you find that in this part of the world, people have malaria. You find them in teaching hospitals, student hospitals, and the rest of them. So the primary health center. Yeah, so the primary health center, so it's on that scale. You assess your primary point of call is the primary health center or your primary provider, as it would be on the empanel list of hospital, and that is where you assess care. And that is at that point that you have the gate where you can be referred to a higher level of care, maybe a government hospital or a private.
Let's go on a break. When we come back, we'll continue this conversation. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So, Mr. Latunji, I want you to talk to maybe Iya Rashidi that is watching right now. And she's a mother. She's alone. Maybe she's a single mother, has 3 kids, and she's a trader. And she's watching the program right now. And she needs proper care. What should she do? Where should she go? Where exactly? How does she get access to what Lagos State is providing for her?
Yeah, Iya Rashidi, if educated, can go online and make payment. Any bank will also do physically and make payment. POSs will be available at various centers within every local government, especially in local government offices and in most of the hospitals we are going to be making use of. The Lagos State government is also going to empower a lot of individuals to be health ambassadors. They are going to be mobile. So they could come to Iya Rashidi's house, knock on her door and register her for free.
So is she paying the 4,000 upfront, or can she spread it throughout the entire year?
Well, insurance is prepaid, but we are working on a lot of modalities to ensure that people that fall within the class of people that may not be able to pay upfront can have the convenience of making some form of instrumental payment.
Can I ask this question?
So we're working on that.
Okay.
A lot of private hospitals that the NHIS, when you go there as a private patient, the NHIS patient, they will not even look at your face. They will answer the one that is going to give them money.
No, not all the time though.
What time are you telling me?
I'm experiencing what White is saying.
I've experienced before.
Please. You will tell your own experience. I will tell you my own experience. My own is that if I come in as a private patient, the NHIS patient, they will be there till tomorrow. If we are 10 with money, cash, hospital will not answer NH or NH whatever.
HMO.
So how do you solve that problem? Because I would hate to register and then I go to
just to ensure that
because I don't have money to pay. I'm waiting for Lagos State to help me pay.
Right. Private patients.
I tell you what, when we do you a card, you know what to put on your card? This is Yeni Kuti. Don't touch that dial.
No. But I also experience it. I mean, I'm pregnant. I go to different hospitals all the time. And if I go with the one with my HMO, I know how I'm served. But when I go private, that's when they now start thinking all sort of tests that doesn't even, you bring out money, all tests that doesn't you need to do this test, do that test. And because I'm a private patient, I'm constantly paying. Because they know that they earn more money from a private patient. So the truth is, if you are carrying that Lagos State card, would you get the same quality service? Somebody who's a private patient, you get that? That's pretty much the question.
Thank you very much. Like she said, it is not whether it happened once or twice that is important. The fact is that it happens.
Exactly.
You know, what we have ensured under this scheme is that such occurrences do not happen. Now, you discover that there's a lot of gap in terms of even knowledge at the supplying, at the provider's end. Some of our hospitals, some don't even understand the concept of health insurance. And it brings my mind to change management. When you are trying to move from a way of doing something to a new way of doing things, it appears very, very strange. So it was a two-thing problem with NHIS. Okay. Things are improving now, and we will ensure that they do not happen under this scheme.
Let me take this call from Ngozi. Ngozi from First Stack. Are you there?
Yes, ma'am.
Thanks for calling. Go ahead, please.
Good morning, everybody.
Morning.
Good morning.
I'm a first-time caller.
Welcome to the show.
I just want to make a contribution based on the question that you asked earlier on. They've taken my funds before 2 times, actually. Yes, 3 years ago when I was still living in Iba. They took my funds. I had them arrested because I saw their faces. And I didn't spread it outside. So this thing is not really about spreading your underwears outside. If they want it, they can use any means. They are desperate people. They came as thieves, as petty thieves. And I saw their face. And when people started screaming, ole, 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 they were the first to scream, ole. I arrested them the next day.
And there's nothing happened to you, Sha? You didn't fall ill or anything?
They had to sign an undertaking at the station.
Right.
So they had to leave me. But a lot of girls that they do these things to, those girls either end up dying mysteriously or they run mad. That is like the number of young girls on the road now.
Thank you, Jare Ngozi.
Thank you. I have a question. There are many policies that they come up with, like Miriam mentioned earlier. There are many ideas that we're not too short of. But we saw how Lagos Homes happened, where, it was really, really, some people benefited from it and then it just fizzled out. How do you intend to make Lashma sustainable in such a way that if I pay now, because the change of government or the change of person in charge of the state will not affect my payment and my access to healthcare?
Aha.
Well, foremost, the Lagos State Health Insurance Agency came to existence through the enactment of a law, which was assented to by the governor, Mr. Kinwambode. So it has a legal framework establishing it. Okay. So it's not by fiat, it's not by some kind of quasi-arrangement, it's by law. So for it not to exist anymore, it means that certain moves must be made in the House to repeal the law. You understand?
There is this question, on Twitter. It says, on LS Health Insurance Scheme, is there an age limit? Can a 60-year-old or 70-year-old couple register? Is there a website to access full details?
Yes, there is a website to access. If you're 60, you can access. If you're over 60, you can access. Like I said, it's
17
you can access, It does not matter. But what we have is that the benefit packages are defined. So if you're accessing care outside the benefit packages, you would have to pay for that. And that is just what we call the basic plan for everybody that is resident in Lagos. There will be other plans as we go by. So you could have top-ups. You could buy other kind of private scheme under the Lagos State Health Care. Then you can have a choice. Yeah.
Let me take this call, then I come to Mariam. Oluwaseun, are you there?
Yes, I'm there.
Thanks for calling. Go ahead, please.
Yeah, good morning, you have.
Good morning.
I want to talk on the insurance scheme about healthcare. What my representative discussed this morning about the healthcare. Can he really break down the insurance scheme? But I want you people to view it to the lower root, to the ground root. We are talking about the hospital generally. We are talking about the what they call health center. How can people benefit from it? Then secondly, to the healthcare, you are talking about the insurance scheme breaking out and all those things. There's a lot of facts that are affecting the hospital generally. That I believe that you
honestly, Oluwaseun, can you hear him? No, I don't. We're having serious trouble hearing you. It's not very
really
clear.
Sorry.
I'm really sorry about that, but Mariam had a question.
Yes, it's the scheme also says it's compulsory, meaning we don't have a choice.
It is compulsory.
So you cannot choose to not be part of it.
If you choose not to be part of it, you may have been on a private scheme, The existence of private scheme in Lagos State, and indeed in Nigeria, predates the existence of the Lagos State Health Scheme. So you advise to continue on your
So,
private.
okay, someone like me, I'm not on any scheme.
Yeah, you are advised.
I don't go to hospital even. Even if I'm sick, I just pray.
You are advised, it's okay. You are advised to come on the LSHS scheme for one reason.
Yeah.
It is cheaper, it's more affordable for you to have a protection plan for yourself, just in case you fall ill. If you do not, you will still have to pay. It is for your own good. It's either you pay an affordable rate now, or when eventually you have the need to consume health, the person may go a borrowing or begging.
Okay, so I want to quickly say that.
But the one you borrow for are the big illnesses, and the big illnesses are not covered under this scheme. So I'm maybe
we are fortunate, we are informed because we play in that industry. And a lot of the debt that occurs, you'll be surprised because of 2,000 naira, 1,000 naira,
yes.
500 naira.
So avoidable death, you know, people that can't get blood or people that can't buy syringe and all of that. Will we still have that issue? Because I use General Hospital, it's already very crowded. So now you want to open the access for more people to get into that same crowded General Hospital. Are you expanding facility to aid this surge that you're going to have in the hospitals?
Well, the surge that you refer to, how many of the people that visit the General Hospital can actually afford to pay for care? You know, if you go to General Hospital today, a quarter of the people in General Hospital are basically roving the compound of General Hospital begging for money.
I use General Hospital. I know that I can afford to pay for care. I go there and I see many people that are queuing up. There's no facility to take the people that are already on ground. That's what I'm saying.
Of course,
you would add more people to that queue.
No. You see, the mechanism is to route those people back to the PHC, where they ought to naturally go. The private hospitals, the primary health care, where they are naturally supposed to assess the first level of care. That's exactly what's going to happen. So you are going to depopulate that place.
There are people listening
and bring
to you right
out,
now. Sorry, there are people listening in Ondo. Yeah. In Edo State. They go, they have this in Lagos State. Please, I'm rushing down to Lagos State right now because then they come to Lagos State and register. So, are you prepared for that influx of people coming in from other parts of the
Foremost, there must be evidence that you're resident in Lagos.
And you have an auntie that lives in Lagos. You call her address. It's not Lagos.
You will not be able to use your auntie's identity to access care. Your own identity to access care. Right. You understand? A clear evidence that you are a resident of Lagos without any doubt of those evidences.
Okay, there's this question. Good morning. I have a question for Mr. Rotimi. The hospitals under the LASHMA, are they all government-owned or private hospitals are included?
Private and government. All those people that you see in General Hospital, a lot of them don't have business in General Hospital. So we're going to begin to do the right things. Right. And that is why we're empaneling hospitals. Okay.
We have to run off.
Okay.
Well, thank you very much. I think we've learned quite a bit from today.
Thank you.
Hopefully we'll bring you back here because this is important. We've always criticized healthcare in Nigeria. So this is a step in the right direction. Hopefully other states can also copy and follow suit. All right, that's all we can take on the show. Don't forget to watch the repeat at 11 p.m. And also tomorrow is a live audience show. Please come early. Have a fabulous day. See you then. Bye-bye. Bye.